the questions, the whole piece will be like a minute and a half.
Okay.
So I'm just going to pull a couple
Yeah.
high-level snippets from you.
Good.
Okay, so we'll start with asthma.
All right.
First one is easiest. Just explain to me, what is asthma?
Man, my glass is fogging up is a problem. Maybe I should not take them off. So asthma is an inflammatory disease of the airway. It results in airway obstruction and increased mucus production, and symptoms result from your airways being blocked off by the airway edema, so the swelling of the airway, and the increased mucus production. So you get wheezing, coughing, congestion, and increasing shortness of breath.
How easy is it for people to kind of realize something's going on if they haven't officially been diagnosed as having asthma?
Yeah, asthma can be tricky. It's one of these diseases that presents in multiple different ways, and so it can present just as a simple cough. You can have, much more complex symptoms with, wheezing, congestion, frequent exacerbations, hospitalizations, ER visits, but it can present very subtly with just chest tightness or fullness or just a simple cough. So it's a pretty large spectrum of presentations.
Okay, so if somebody's experiencing one of those things, best step is to call their just primary care doctor?
Yeah, I think usually you start with your primary care physician, or if you've been to an urgent care for a recent exacerbation, usually they'll be able to kind of help direct you. And we do see patients in the pulmonary clinic on a self-referral basis if necessary. We're always happy to see them.
What when somebody is diagnosed as having asthma, what are some of the treatments? Is this something that's they're going to grow out of? Is it a lifelong thing? Talk about some of that.
Yeah, so asthma can pretty much present any time in life. A lot of people will develop asthma as a child and will kind of grow out of it. Maybe it can come back later in life in their fourth or fifth decade. But frequently patients will present for the first time in their 60s. And so it can really present at any time. The treatment that we have is designed at decreasing the inflammation in the airways. So we're using inhalers that deliver medication to the airway that will help reduce swelling and open up the airways to minimize symptoms and treat the underlying problem.
With COVID, just to try to make this one timely right now, you hear that people with asthma are at higher risk. Talk about why that is, or how some of that, or how it manifests itself.
Yes, actually, asthma really does not seem to increase your risk very much of having complications from COVID. Clearly, you don't want to have poorly controlled asthma in this day and age, because that might make dealing with a COVID infection more difficult. But really, it's been looked at pretty carefully, and asthma just doesn't stand out, as a risk factor for developing COVID or developing complications from COVID. I think that if you have asthma, you should continue taking your medications. So inhaled steroids are fine, your biologics are fine. We want you to remain well controlled during this pandemic. And so continuing your medication and continuing follow-up is really important.
And then it is something I heard you say, you can kind of grow out of it, not
Right.
necessarily maybe with you forever, kind of dealing with the symptoms. So it goes both ways?
Yeah, so a lot of times, asthma can be a problem, for a fixed period of time, and then will kind of go away on its own. When we're children, and sometimes they get asthma, they will tend to grow out of it. But even if you get it as an adult, sometimes just controlling the symptoms for a period of time will allow the symptoms and the underlying problem to abate, and you'll become symptom-free and can get off medications and stay off medications.
Is there anything people can do to decrease their chance of becoming an asthmatic?
Yeah, I mean, asthma is a very complicated disease that is an interplay between your environment, your genetics, smoking, viral infections, all those kind of things. So it's really not one simple thing that you can do. It's very likely there's nothing you can do to prevent it from happening. I would say obviously not smoking is important, minimizing your risk of getting infections, Obviously minimizing, your exposure to pollutants and things like that, which is obviously not easy to do.
Okay. Anything else on this one that
No.
patients ask a lot? Any questions? Okay. Let's move on.
All right.
To lung cancer, switching gears. Talk about, so this will air in November, so Lung
Mhm.
Cancer Awareness Month. Talk about just the importance of lung cancer detection and early detection.
Yeah. So lung cancer is the number one cancer. Hold on, start over. Lung cancer is the leading cancer death. Hold on, that's not the right way to say it either. It's the leading cause of death related to cancer. Okay. So lung cancer is a leading cause of death related to cancer in men and women. So if you take cancer deaths from colon, breast, and prostate and add them all together, it still doesn't touch lung cancer deaths. So this is a really important problem. Breast cancer, prostate cancer get a lot of press, but really lung cancer is a much bigger issue. And it's been well shown that early detection of lung cancer improves survival. We know that patients with stage 1A lung cancer have a 90% 5-year survival. Patients with stage 4B lung cancer have a 0% 5-year survival. So
1A being the lowest, 4B being the highest.
that's correct.
Okay.
So early detection is very important. It makes a huge difference in your ability to treat the cancer and survive the treatment.
So how can it be detected early?
So lung cancer screening has been shown to be effective because you have a disease that is pretty prevalent, you have a disease that is pretty severe, and a disease that, if detected early, you can have an impact on it. So screening is important, and so if you're between ages 50 and 75, you're a heavy smoker, or you've quit in the past 15 years, you should be screened for lung cancer. You should talk to your primary care doctor or your pulmonologist about being screened for lung cancer.
What's the magic of that 15 years? Like, if you haven't developed it in 15 years, you're not going to, or?
After quitting smoking, your risk of lung cancer decreases after about 5 years and continues to decrease for 15 years. After 15 years, it stays pretty flat. It never goes back to baseline risk, but your risk is about 3 or 4 times the general population at that point, but that's kind of when the risk kind of levels off.
Okay. And then, I've heard of multiple people who have had lung cancer, died from lung cancer.
Mm-hmm.
I've never smoked in my life. What
Yeah.
about those people who are thinking, I've never smoked, but I keep hearing this, important message. What am I supposed to be doing?
Yeah, so about 90% of lung cancer is associated with cigarette smoking, but there are multiple other risk factors, and so secondhand smoke, marijuana smoking, vaping, those kind of things can increase the risk of lung cancer. Just unfortunately being in our industrial environment, airway pollutants, radon exposure. So if you have a basement, you should be checking your radon levels and making sure that your house doesn't have elevated levels of radon. There are other occupational exposures. Patients with underlying lung disease like pulmonary fibrosis and COPD are inherently at higher risk for lung cancer. So there are other occupational and other medical conditions that will increase your risk. But by and large, lung cancer is a smoking-related disease. But we are seeing over the past 10 years or so increasing incidence of lung cancer in non-smokers.
What signs, if somebody's, doesn't fit the screening or just hasn't gotten one, what are the things that should clue them into, maybe I should talk to a doctor?
Yeah, so mostly lung cancer is without any symptoms, and that's why it's such a dangerous problem, is usually patients don't begin having symptoms until their disease is quite advanced. But when you do develop symptoms, it's frequently something like cough or coughing up blood, maybe your shortness of breath because of a fluid collection around your lung. Weight loss can be a presenting symptom. Usually it's pretty nonspecific and pretty mild until it gets pretty advanced.
And then what are the options for treating it once it's detected?
Yeah, surgery is still the primary goal when possible because it increases your chance at a cure. If surgery is not an option, so for further people who have more advanced disease, chemotherapy and radiation are still very good treatment options. And patients who are more fragile and have other comorbidities and may not be able to undergo surgery, SBRT, so focalized radiation, is a very good option. And we have a very good radiation oncology department here at Martha Jefferson. And so that is always something that we would consider for those patients who can't have surgery.
Great. Anything I'm missing on this one?
Nope.
Any questions? Okay.
Is that good?
Hopefully that wasn't too painful.
No, that was easy.